Have you ever had somebody die of asthma?
I don't know.
Have you ever heard? You know,
I've not heard of it.
Because asthma is predominantly a disease of the airway, not necessarily of the lungs.
Okay.
But in asthma, it is your immunity that overreacts. So
it's hard to take some people away from what really causes their asthmatic attacks per se. But if you can avoid it, just avoid it.
And of course, here on the Med Squad, we say, if you sense a whiz, kid, get help. Welcome once again to another fantastic episode of the Med Squad podcast. Now, let's take you back in time to your primary school. Some of us went to primary schools where we were responsible for the cleanliness of our own classroom. So we had different responsibilities for different groups. There's the group that sweeps the dust, then the group that washes with the water and everything. Then there's the group that wipes. Now, there were certain students who were exempt from this activity. And it's those students we're focusing on. Are they adults now? Or when did it start? We're talking about the difficulty in breathing in Africa. My name is Yafesi Musoke. I have the Med Squad with me, and they'll introduce themselves from my left.
So thank you very much, Yafesi. I am Anthony Ndegwa, General Medical Practitioner at Zuri Health.
Yes.
Thank you, Yafesi. I'm Georgina Nyaka, also a General Practitioner at Zuri Health.
Karibu.
My name is Flavia Bagatia, and I'm a medical officer.
Yes. Now, we're talking about struggling to breathe in Africa. And that difficulty, of course, is medically termed asthma. Or am I actually terming it correctly? What exactly is asthma, if you define it medically?
We could describe asthma as it's generally an allergy.
An allergy?
Yeah.
Okay.
It is an allergy to certain things that are inherently non-harmful. We are talking cold, dust. To the normal extent, not everybody will be affected by dust the same way somebody with asthma is affected. So it's a chronic, reversible condition that affects our ability to breathe. Okay?
Yes.
However, if not treated properly, can be associated with other respiratory complications. Yes.
Okay.
Also, in asthma, there's a hyper-responsiveness, an exaggerated response to these triggers.
Yeah.
In which normally the normal person, I should say, will not react to, but an asthmatic person can react to. And this causes an inflammation and swelling of the airways.
Yeah.
They become narrow, and then the muscles around the airways constrict. They press them together.
Yeah.
I should say that, causing difficulty in breathing, and also there's a lot of mucus produced.
Yeah.
So there's difficulty in breathing, there's chest tightness, and there's wheezing. That sound, that whistling sound, is because there's narrowing of the airways.
Yes.
Air is passing through a narrow passage.
Yeah. So it's like, air is just struggling to pass through. Okay, so Dr. Anthony had mentioned some of the triggers or the things that you're reacting to are inherently harmless. Could be like pollen, it could be dust, things like that. But other harmful things like cigarette smoke and either things you ingest or secondhand smoke, are they also triggers in the constricting of the wind pipes?
Okay, so I'd say first with cigarette smoking, let me just start from the top. So yes, cigarette smoking can lead to somebody acquiring symptoms similar to asthma way later in their life. Yes, chronic obstructive pulmonary disease. But now, when we speak about cigarette smoke causing somebody to behave or cause somebody asthmatic to have an asthmatic attack, I wouldn't call it like, yes, it would. Because when we're talking about asthma, we're talking about allergens. So this is dust, pollen, animal fur. Yes.
So
Also, cigarette smoke can actually cause an asthmatic attack.
Okay.
Can cause someone to react.
Yeah.
Cigarette smoke and also firewood, actually.
The firewood, yes.
Yes, firewood.
Firewood. And then we're looking at also harmless things like exercise.
Oh,
We're looking at, of course, the cold, the weather,
yes.
and also some emotions. They can laugh too much, and then it's also a trigger.
Yeah. You laugh until the
Not until, but there's that exchange of cold air when you laugh. There's an so it becomes a trigger.
So you're reacting to the air.
Yes, you're reacting to the air. It could be cold or it could be dry. Yes.
So if you laugh in a warm, humid place, you won't get the same. I don't know. Or you laugh where there's steam. You laugh in a sauna. But a lot of our memories, or my memories rather, with people who had asthma were childhood memories. And so is it something that can develop later in life, or is it like strict or predominantly among children?
So asthma can start at any age. Okay. There is familial history where if your parents have asthma, then your risk of developing asthma are very high. So according to the Kenyan guidelines, or probably even borrowed from the international guidelines, like the Global Initiative of Asthma, we diagnose asthma after the age of 2 years. Okay. That is based on clinical symptoms. However, there are other imaging tests and other modalities where we can screen for asthma. Now that is childhood asthma. And the good news is sometimes people outgrow asthma. It means you had asthma as a child, but you grew up and your immunity strengthened and the immunity behaves.
Oh, that's what you said, reversible.
Yeah, it's okay. It's irreversible in terms of, if, for example, you get something, she talked about COPD, there's no going back. You have permanent destruction of your architecture. But in asthma, it is your immunity that overreacts. So think of that pipe. So because asthma is predominantly a disease of the airway, not necessarily of the lungs.
Okay.
Okay? The airways to the lungs. Okay?
Yeah.
So you're saying that asthma is reversible in the sense that if somebody has an attack now, an exacerbation of asthma, then if they're given the right medications, think of medication that just open up your airways and reduces the inflammation. And we're going to talk about what it actually is in simple terms. However, think about your immunity. So there is an inherent immunity in your airway. Every part of our body has its own immunity.
Yeah.
And the mechanism it's used to protect itself against the noxious elements in the environment. So number one is cough. Cough is protective.
Yeah.
If that one grain of rice goes the wrong pipe, you cough. The reflex to just help you expel that. Okay? So cough is protective. However, now when it comes to asthma, you now have a chronic cough, or a cough that is now bothersome with no apparent reason. Okay?
Yeah.
Because your immunity is just kicking in. Think of mucus production. It's very normal for you to have mucus production, but it has its reasoning and function, and that is to trap dust. So, and that is to trap dust and think of insects that might just go down that stream.
Yeah.
The other aspect is there's some level of movement. We call it serial movement. Some things that we say they're like, let's say, like hair that are keep on moving.
Yeah.
Such that when that mucus is produced and there is something trapped, then there is a movement on how you can get up into your mouth. So in children, when that mucus or that flame or that semi-liquid something gets into your mouth, they can swallow it. Children don't expectorate, they will swallow it. Okay. So when they swallow it, down the abdomen, there is gastric juices.
Yes.
So probably all the bacteria there, they'll be dealt with. But for adults, they're likely to spit it out. Okay? So those are the mechanisms that we have that protect our airway. However, now as she said, there is hyperreaction. Hypersensitivity just means it's an atopy.
Yeah.
An allergic reaction to something. So it is an exaggerated response to otherwise normal things. So this can also happen at older age or in adulthood at any point in your life past. And this is going to be associated with your lifestyle. For example, you could have a familial history, but again, if you smoke, okay, if you have other chronic illnesses, then you are likely to develop these problems. So it is not a disease of childhood alone.
Okay.
Yes.
Hey.
Also, for adult onsets, some research says conditions like gastric reflux, GERD, can irritate the airway and someone gets adult onset of asthma.
So like when you feel like
Yes, that's
after
gastric,
lunch.
yes, gastric reflux.
Oh, that can actually
It irritates the airways and someone ends up with that.
yeah.
And in premenopausal, they also say the hormones can also trigger the asthma adult onset.
Yeah. Do work conditions also affect that? Because like say you work in event management, doing late nights in the cold, setting up in the hot sun, so that change of temperature all the time, can it also kind of produce that kind of reaction?
I would say it more of triggers the attack. There is what they call occupational asthma that you get at the workplace, but it's more of irritants around the workplace.
Yeah.
The dust, the mold, the dew. Yes.
Oh yeah, like if you move into a house that has mold. Hey, occupational asthma. So when we come back, right here on the Med Squad podcast, we'll be looking at some of the myths that make it difficult for us to breathe. Occupational asthma, that's something I'm finding out just now. You could be sitting at your desk with occupational asthma. Stick around. You're on the Med Squad podcast. Welcome back to the Med Squad podcast. My name is Yafesi Musoke. I'm Dr. Anthony, Dr. Georgina, and Dr. Flavia right here with me as we talk about asthma. Is it difficult for you to breathe? To what extent? There could be underlying causes, or it could be just something else. Like for instance, there is a myth, although from what we've discussed earlier, it may not be a myth anymore, that you will outgrow it. You will outgrow asthma.
Yes, that is not a myth. That is true that there are some people with childhood asthma, they cannot grow asthma.
They can outgrow?
Yes.
How do they outgrow? What do they have to do to outgrow it?
So you see, it is your immunity getting, let's say, more adapted, and as I said earlier, it's a misbehavior. It is your immunity that goes bananas. It does not know the limitation on what to react to or not. So with more exposure, let's say in layman's language, your immunity becomes or comes into realization that perfume is not toxic. That perfume is yes, it's nauseous enough, but it does not necessitate somebody to have all this. Remember, it's number one, it's inflammatory.
Yeah.
So in simple terms, what inflammation is a second line of defense in our system.
Yeah.
So the first line of defense is our skin barrier method. Then the second line of defense is inflammation. So it has a lot of chemical chemical bases.
Yeah.
However, the simple characteristic of inflammation is number one, swelling. Okay, as we said. Number two, there is also pain.
Yes.
So some people have chest pain. Okay, there's also production of excess mucus, as we say. But we say mucus is normal, but now this is excess. Remember, exaggerated response. So it could be a normal response to some other bacteria. But now with asthma, asthma can also be triggered by infections. Okay,
Yeah.
because it's an awakening of the immune system.
Yes.
However, we are saying the response is not proportional to whatever we are trying to fight off here.
Yeah.
Yes, and that's the aspect. So when you're saying they outgrow, is we see less attacks. We don't say they are now not asthmatic. We're just saying they are still. You see, there are triggers that you might not be able to, like you might not be able to avoid. For example, this month is so cold. Okay, there's someone who has never used their medication for the last 6 months or even 1 year. And they still think they are asthmatic, but they don't have, because the only way, in fact, earlier, the only way we could know that you're asthmatic is symptoms plus are you able to respond to some medication we use, bronchodilators, which we use. So if you respond positively, so you had symptoms, we give you the bronchodilators through nebulization and you respond and you are asthmatic. But now today, if you don't get the attacks,
Yes.
and you're exposed to the allergens,
Yes.
then you just like me and you, that there is cold, but we don't have wheezing and difficulty in breathing, but that is not related to any other infection.
So he mentions bronchodilators, like inhalers, things like those that open up your airways. Now, there's a myth or that something that people might say that, inhalers are addictive. So it's better not to get started in that
That's
area.
not true.
Mm-hmm.
No. So I don't know where that came from, but inhalers are not addictive. Inhalers, so different inhalers have different combination of medication. There are some that have bronchodilators. There are some that have corticosteroids. So these ones that have bronchodilators,
Yeah.
as we've said, asthma comes with constrictive airways, right?
Yeah.
So bronchodilators aim to enlarge the airways, make them relax, so that air can pass more easily.
Yes.
So they don't have any addictive substance in them per se.
And the ones with steroids?
The one with corticosteroids are meant to now reduce the number of attacks.
Oh.
Yes.
And also to control the inflammation. Because when inflammation starts, like Anthony was saying, there's mucus production, and then there are more inflammatory cells that are produced. So the corticosteroids control that.
Yeah.
While the bronchodilators are going to enlarge the airway.
Yeah. Okay. These things have a lot of work.
Then you realize there's also a combination of both.
Yeah.
The corticosteroid and also the bronchodilators.
Yes.
Then we have what we call relievers. That are used when there's an attack. Those are the bronchodilators, like she was talking about. The salbutamol in the inhaler form. Those are the common examples.
Salbutamol.
Yes.
Yes.
The Ventolin, sorry, it's the Ventolin.
So on the same,
Yeah.
modern studies have shown that the salbutamols, the Ventolin, we want to put them away. Why? We had,
Why?
the reason is, why should we wait for you to get an attack and then relieve you? We want you to never have an attack.
So preventative.
And have you ever had somebody die of asthma?
I don't know.
Have you ever heard?
I've not heard of it.
So the reason modern medicine has offered us solutions where asthma no longer kills people. Why? Because of steroids. Okay. So steroids we already have a steroid hormone in our body, the cortisol hormone. When it's released, it causes immunosuppression. It suppresses your immunity. Okay. And we are saying that asthma is an issue of your immunity overreacting. So if we suppress it, we achieve better control at the expense of invaders, the infections. Okay.
Yes.
So, however, now the scientists sat and they were like, oh, if we give you a tablet that goes through your bloodstream and causes the whole body to be suppressed, there is an issue there. Now they made the inhalers, meaning you're only suppressing that area that has an issue. Okay? So that is where corticosteroids are today. The gold standard management of asthma.
Yeah.
If you use your corticosteroid properly, then you don't get an attack because your immunity is always in check. Okay? It's always kept down. So if you have two inhalers, one is a bronchodilator and the other one is a steroid, if you use your steroid properly, then you don't use the other.
So now someone
So
in fact, I can
about-
ask you this so that you also answer them together.
I want to.
You want to go?
Yes.
Corollary.
So about 300 million people
Yeah.
worldwide are affected by asthma. And then 250,000 die of asthma every year. So people still die of asthma.
They die of asthma.
And it's because of the poor control. You see, we're trying, like Antonia said, we're trying to get away with the bronchodilators, only inhalers, because they don't reduce hospital admissions.
Okay.
The corticosteroids or the combined inhalers actually reduce hospital admissions.
So the mortality rate of asthma.
Yeah.
With the introduction of corticosteroids, what kills people today are the complications of asthma. Okay?
Complications, yes.
You don't take medication, you take nothing, you get, you have wheezing, difficulty in breathing, your saturations are low. You don't die of asthma. Over a long time of that unmanaged or poorly managed asthma, you can develop heart failure called copropneumonia. Okay?
Heart failure?
Yes.
Okay.
You can also develop other chronic obstructive or restrictive diseases such as COPD.
Yes.
Okay? You can develop other problems like bronchoectasis and all those kind of diseases. Okay? However, asthma itself is reversible.
Okay.
You see?
Yes.
It does not cause mortality as people think. Okay?
So the 250,000 who died,
those are
It's
the complications of asthma. Not its mortality itself, because it's a reversal. It's something that today you have it, tomorrow you're like you've never had it. You're just functioning normally because there's no structural damage to the architecture. It is temporal.
Okay.
And then the moment the offender is removed and we have some remedy for that, you go back to normal.
Okay.
Continuous causes now complications.
Yes.
Or kill you.
So there was this one time, I tell a personal story here. That's why I was talking about working day and night. And I was taken and examined and they said, your body is behaving as if it has asthma, but we know you don't. So it was because of the exposure to cold. And so if someone just says, it's just stress and anxiety, can they ignore it if in their heads they know, if I stop doing this, if I stop living this kind of lifestyle, it will go away? Or is it still a worry? Is that a myth if I just, don't worry about it, it's stress and anxiety?
Okay, so to answer your question, I'll take you back to what Dr. Anthony said. For us to classify it as asthma, your body has to overreact to a certain allergen, right? Be it dust, be it cold, be it pollen, be it fur from animals.
Yeah.
So when you said you were exposed to cold for some time, and then when you went to hospital, your doctor told you when you're out of that working environment, you'll be okay. So I can say that's true. But again, when we look back on work-related hazards, like let's say somebody who works in a cement factory. So this is somebody who's been exposed to dust for quite some time. I'd say that will be true for him if he is taken away from that environment. The same to those roofing tiles were done away with, the one that contained asbestos and everything.
Oh, okay.
So if you take somebody out of that environmental exposure that gives them that similar symptoms, but this person is not asthmatic, I would not have classified you as asthmatic by then. Yeah.
So now imagine taking someone out of a flour mill, and that's where he earns his livelihood. Now you tell him go away, but the flour is entering your face too much. So there's obviously there are other sides when it comes to myths. There are others that are kind of sensitive because some people it may be a bit. If I pray hard, it'll go away, and yet we have seen practical ways in which it can go away. But there's another myth that goes with only because we remember primary school, those who they were not able to swim, take part in some sports or do things that involve dust or cleaning and all that stuff. So the myth is, or that's stated, is only weak kids have asthma. Is it a sign of weakness to have asthma?
No, it's not.
It's not that's very wrong.
Mm-hmm.
Okay. So you see, you cannot say a condition or a disease is a form of weakness.
Mm-hmm.
It is something nobody wishes to have such a kid, or even the kid, nobody wish to have a condition. So asthma is a disease. So it is not a form of weakness.
Mm-hmm.
And everybody is a candidate for the same. So today you can be a stronger child, but you can be also a weak adult and develop full-blown asthma in your adulthood. So that is very wrong, and that is not true.
Okay. So in line with that, then we can't say it's the parents' fault then that
No.
someone has asthma. Or
It's
the
not
child has
anyone's
asthma.
fault,
Yeah.
but we're looking at genetics and environmental factors. So for genetics, you have no control over. Same applies now to environment for this case, because it's allergy. However, there is something they call the hygiene hypothesis,
Mm-hmm.
which refers to children who are exposed to some certain microorganisms at a younger age.
Yeah.
They develop an immunity to them, in that this immunity helps them at later on when they've grown up, and they are at a lower risk of getting conditions like asthma, other allergies like atopic dermatitis, and certain autoimmune diseases. So there's that hygiene hypothesis surrounding the cause of asthma.
Mm-hmm.
Yes.
So if I keep my house very, very, very clean and remove things like asbestos and cats and dogs, so there's a higher chance that we will not develop. But
no, we're looking here. They say now, when you look at that, you look at people who are from the rural areas, and then people who are the other side
yes.
of the spectrum. So when you look at that hypothesis, people who are in rural areas are exposed to these microorganisms more, so they'll be protected.
Yes.
More than people at
Who
the
are
other side.
over clean.
Yes. However, the late diagnosis and people dying from complications is in the rural areas because of poor access. One, to the inhalers, but also there's late diagnosis.
Yeah.
Mm-hmm.
Hey, okay. So that's a dilemma, because you're seeing adverts everywhere telling us to clean every single thing, clean surfaces till it's sterile. And then, so when you're younger in the rural area, you have a strong immunity.
Let's just say when a child is young, a baby is crawling, let the child play.
Yes.
The baby is crawling like, they're crawling in that. They're just crawling on the floor in the house, and they're crawling in that. Let them play. Let them crawl.
Then now when we're adults,
Let
is
them
when
be,
we clean up.
yes, let them be exposed to those organisms.
Okay. You're on the Med Squad podcast. When we come back, hey, now that we know that cleanliness is good when you're an adult, anyway, we will actually be finding out why asthma is so dangerous in African communities. Why is that? Knowing that it's something that's pretty simple to deal with. We'll be right back. Welcome back to the Med Squad podcast, where we have candid conversations about health and how it affects you across Africa, wherever it is that you are, and whatever issues that you have. And the conversations are quite candid. Today, we're talking about asthma and finding out why it is so dangerous in African communities. And one of the things, when you mentioned the allergenic aspect of asthma, it means at some point, if I'm wheezing, or if I'm coughing, or having that kind of reaction, it might be misdiagnosed by someone who doesn't know. So how prevalent or how often can it be misdiagnosed, especially if people, don't have that health-seeking behavior? I'm learning these terms, health-seeking behavior.
Exactly.
So it's a commonly misdiagnosed condition. So and this is as a result of how close in terms of symptomatology it is to other conditions.
Mhm.
So majority of all the airway or probably respiratory tract conditions, they share a lot of symptoms. The cough,
Yeah.
chest pain, the difficulty in breathing, the fast breathing probably in children, the issues of too much production of mucus and all those things. So you realize sometimes it is a disease of exclusion where you know that the problem we are dealing here with is not a community acquired pneumonia, because can also give you the same symptoms. Okay. However, we said that the key thing about asthma is that it's reversible. In that, if somebody came to you with pneumonia, difficulty in breathing, cough, wheezing also, and you give them Ventolin, they will still not be okay. Okay. However, for someone with asthma, it is immediately they will feel better. Okay. So, however, let's say currently the awareness in terms of asthma is better than we were before. We are doing better in terms of the diagnosis. We have access to screening tests like spirometry for other differential diagnosis like COPD, as we spoke before. We are doing more tests on sputum and gene expert for tuberculosis. And generally some other conditions like other conditions that they tend to come simultaneously with asthma, like allergic bronchitis and all those kind of conditions. So the dilemma sometimes is sometimes you're in a dilemma of, am I dealing with an exacerbation of asthma or is it an active infection? Because we're also saying that infections can also cause exacerbation of asthma. You get the point. However, it is a very commonly misdiagnosed condition where people are just given more antibiotics for pneumonia in most cases. And even when it's diagnosed, the management again is neither here or there. People are given antihistamines for asthma. And you find it's a waste of the time for both the healthcare provider and the patient.
Yeah. Okay.
Also, to add on, in Africa, we're mostly using symptoms to diagnose asthma. So, especially for wheezing, when someone is wheezing, most clinical people know that, okay, this is asthma.
Yeah.
But also, there's asthma that doesn't have wheezing, the covariant asthma. So, basing on symptoms alone, we might be misled. But like Anton has said, using lung function tests is the leading modality, the correct modality to diagnose asthma.
Lung function tests.
Yes.
Those are
Spirometry, the one he has talked about.
Yeah. So that's to check how well
you're breathing in and breathing out, how much air comes out when you're breathing out.
Okay.
For asthma, it is reduced by a certain percentage.
Yeah.
And if you're given those bronchodilators, it opens up, it becomes better.
So it's more of a comparison of before. So when you came and after we give you the bronchodilators, how is your function? However, we have to be realistic that there is little access to spirometry or the lung function tests. And majority of us will just use criteria as clinical evaluation for patient. You rule out TB, rule out pneumonia, all the other conditions. And then you're like, oh, you are responding to this medication. Then you probably asthmatic.
by elimination.
Yes.
So now, the thing, you mentioned bronchodilators a lot. Another thing in African communities or the context, let's say an inhaler, it's not cheap. So how, is that also part of the problem? Fine, you have all this. How do you buy it? Why is it not in a first aid kit or something? How accessible are inhalers for the common citizen?
I would say inhalers are not so common, especially in the rural areas, and that's part of the problem.
Yeah.
Then also them not being in a first aid kit, we should be more sensitized about it. We should create more awareness about it. It should actually be there.
In the first aid kit?
Yes, because if someone has an asthmatic attack, that inhaler is a lifesaver.
Yeah.
So it should be something added.
Maybe it's because in a first aid kit, it might be used by multiple people. So now you're putting something that someone else has already.
But I think on the other hand, it's more of costs rather than availability, because inhalers are costly in the long end.
Then you find that people in the rural areas are now using the oral medication, the tablets, salbutamol in form of tablets. Then also they're using the corticosteroids in form of the tablets, which are in a long-term use, chronic use of corticosteroids can cause complications. We're looking at conditions like Cushing syndrome.
The which syndrome?
Cushing syndrome.
Cushing.
Yes.
Ooh.
So what happens in Cushing syndrome, you see, cortisol is made by the adrenals, the adrenal glands.
Yeah.
Naturally in the body.
Yes.
So when you keep on adding the systematic one, the one in the inhaler goes straight into the lungs.
Yeah.
And there's little that goes to the body. The one that you swallow is going to go to the body.
Yes.
And it's one that's going to cause the complications. So when you keep on adding this cortisol, the body is going to stop
producing its own.
And then you're going to rely on this one.
So the body will be like, oh, you're producing cortisol, so I'm on vacation.
So in Cushing syndrome, you find someone more at a risk of getting hypertension or getting blood pressure.
Yeah.
Increased blood pressure. Then also you find their skin is it's thin and can easily be damaged. And then you find they have excess fat deposits, like in the trunk.
Yeah.
In the stomach.
That, yeah.
And also they have we call it a buffalo neck.
The neck also thickens.
Buffalo back. The fat is on the back. Yes. So that is for chronic use of oral corticosteroids. So we advocate for the inhaled one because they have less side effects.
Okay, so the inhaler is better than the ingested.
Exactly, and it works faster.
Wait, so now, in line with all that, because we are still dealing with the African context and why it's so maybe exacerbated, while there's the cleaning that we see on adverts, over cleaning of things, in general, our environment has still a lot of nature. There are not as many concrete buildings. We still have the dust. We still have firewood being used, smoke, other triggers like pollution. If you're public transport, all these things, smoke, all that stuff, fumes. How do we manage that? Because if we can develop it later as adults, at some point, every African will have a near encounter with asthma. So what do we do? Because you can't be dodging fumes. No, when you see a bus, missed me. You go and eat mutura and or is that what we're supposed to do?
I think to answer you, like you've said, as we were growing up, some people were exempted from doing certain duties because they cannot be exposed to dust. So I think where we are as at now, you cannot avoid some things in life because when it comes to planting season and crops sprouting, producing pollen, you can't stop that.
Yeah.
But again, things that you can stop, like dust exposure, exposure to smoke from firewood. People nowadays are advocated to use gas, cook with gas, but also it comes to the economic status. Are we able to afford it or not?
Yes.
So it's hard to take some people away from what really causes their asthmatic attacks per se. But if you can avoid it, just avoid it.
Well, that one just means have a conversation with the neighbor and tell him, stop burning leaves. Who do you think you are? But then also, schools and workplaces don't seem to be, I don't know what to call it, asthma friendly. It's like, it's dealt with when a case arises. So like cold showers. And that's when you find someone has asthma, then they're like, okay, this one will get hot water. And this. So how can we make homes, schools, workplaces more asthma friendly or asthma considerate?
So I just think it goes down to our policies. For example, in Kenya, in that these things are dealt with from a case to case rather than having policies that cut across for different diseases. For example, you still see, even in the modern age, that you still have schools that are not disability friendly. So even asthma is also a factor. However, you see, with asthma, it is an issue of avoiding triggers because you must need that immunity. So you cannot do away with the immunity.
Yeah.
And it is likely to overreact to something. So you need to find what are your triggers. If it's dust, sometimes you don't have control over the environment.
Yeah.
But what can you do yourself? If you cannot control the environment for the exposure, then you have corticosteroids there for you.
Yeah.
And we have a way of delivering this medication for children with spaces. So they're still okay. However, from school point of view, I think it's a more, other than policy issues, talk about awareness of the heads of schools. Are they aware that these children can have this kind of environment and all those things? I think it's a work in progress. As we continue, we realize that even in school, people are struggling to understand that there's even mental health rather than just asthma and all those things. So I think going forward, that we will get there.
We will get there. Yeah. Is there anything you can add to making the school environment, work environment, either friendly or better receptive of people who are living with asthma?
Yeah, it all boils down to awareness. Like, let's make an example right here. If either of us right now want to get an asthmatic attack, who knows what to do?
Then inhaler nearby.
Yeah. And then do you know whether I have asthma or not? Like, it all comes down to awareness. Are people aware of what to do in certain circumstances?
Yeah.
Again, is your working environment receptive enough to help you when you get that asthmatic attack? Or would it be, I'm now down, gasping for air, and the first thing is, look for an Uber, take me to hospital. No first aid there, just awareness.
First aid.
Yeah.
Okay, that's pretty critical. So when we come back on the Med Squad podcast, we'll be summing this up and landing this plane, but leaving you with something that can help you breathe. Stick around. Welcome back. This is the Med Squad podcast. We're trying to break things down from the complex to the simple, because breathing is supposed to be that simple. As we talk about asthma, wanted to ask, there are some popular opinions. I don't know if they're popular. They're just opinions that I usually put out there. But before I get to those opinions, as someone who's living with asthma, or if, say, I'm a parent, my child has asthma, what are the words, like if I go on the internet, because sometimes parents, the first thing they do is go on the internet, what are the words that will stand out to me when I'm looking for remedies or solutions when it comes to asthma? Can I live with it? Can I swim when I have asthma? Can I eat this? Can I engage in this activity? Are there any specific words that would be of interest to me?
Yes. So when you try and Google, you will see that it is reversible.
Reversible.
Okay?
Yes.
It means there's no permanent damage. That is something you'll see. The other thing is you'll see it is inflammatory.
Inflammatory, okay.
Yes. So that is the other word you'll see. That is in response, that is in relationship to it being some form of immune mediated. Okay? It is your immunity that is causing all these issues. Then, and the other factor you will see is that you can see the word atopy.
Atopy.
Yes.
Okay.
Atopy is just a general word for allergies or hypersensitivity to things.
So I shouldn't be too shocked.
Yes.
These are just common.
Yes. You will see triggers. Okay. So you will know that there's something that causes the response. So
Yes.
it is a response to something. So if you are facing you are rude to me, I can have an asthmatic response to your rudeness by my emotions going up and
It's not asthmatic. It's anaphylactic.
okay.
Over exaggerated is anaphylactic.
Now that is in response to chemical, or let's say what do we call them? There's a protein word for it. What do we call
Allergen?
it? Anaphylactic is a response to
Responsiveness.
to let's say, for example, a bee sting.
This thing.
We're talking, there's a chemical component or molecule
Ah,
that the immunity is targeting,
okay.
but is again over-exaggerated
Yes.
and can cause you more damage. So you see, it's, for example, you see somebody walk into your house and then you burn your house. So you kill everyone in your house, including the enemy. You see, now you're causing more damage to yourself
More damage, yes.
than good.
Yeah.
Okay? That is more of anaphylactic.
So that's anaphylactic.
Yes.
So yes,
Yeah.
So
goodness.
also, for parents,
Mm.
one, they should have inhalers and they should be aware of the content of the inhalers. Two, for children, it's better we actually use spacers.
Spacers.
Yes.
Yeah.
A spacer is like a chamber. I can call it like a chamber connected to the inhaler.
Yeah.
And then for some, they have masks, others don't have. So for when someone uses a spacer, they're going to get more medication into the airways. They get like, let's say 70% of the medication will reach the airways. But if someone is using an inhaler, they might get about 40%. But also with an inhaler, the medication, some of it will go at the back of the throat.
Yeah.
And for some, it even cause irritation because it's dry. But for the spacer, it goes direct into the lungs.
The line.
And also, you see, there's a specific way you're supposed to use an inhaler.
Yeah.
So for the children, they
No, not everyone
So,
knows how to.
not that.
Yeah.
So for the inhaler, how to use it?
Yeah.
You shake it first to mix the medication.
Oh, you're supposed to shake it.
Yes,
Don't
because
just,
there's a propellant and also there's a drug, the medication in form of particles.
Yeah.
So you shake it to mix it. After that, you take a deep breath. Wait, you shake it, exhale. Then
breathe out. Okay.
breathe out.
Shake.
Exhale. Then put the inhaler. Then as you're
Press.
taking in a breath, as you're inhaling, you exactly.
So you press as you.
Then you give it time.
Yeah.
You can't like for 10 seconds, then you can swallow and you let go.
So if you press before you breathe in, you just have a mouthful of inhaler stuff. Does it taste
You
nice?
press and then you
So the idea,
and then you
it shouldn't be
hold
complex.
it.
The idea is,
So you see all that.
Yeah.
It's not easy for a child. The spacer, you can't tell a child to inhale as they press. It's difficult. So the spacer makes it easier.
Yeah.
It's a continuous flow of medication. As it's on, the medication is going in.
Even holding for 10 seconds for a child.
No, they can't.
Yeah.
That's why in children, she's mentioned you're using spacers.
The spacer does that
So
better.
this. Hey.
So for a
So you see,
parent who can
the issue
afford,
is-
can get a spacer.
the spacer is like a funnel.
Or not like a booster.
So it is there, making sure that we cannot control how you breathe, but we are sure you're going to breathe.
Yes.
So when you breathe,
Yeah.
the drug will be there.
Okay.
It is part of the oxygen you breathe in.
Okay.
That's just the spacer.
All
But
right.
for you can control
You
your
do the
breathing.
Okay, so now with these opinions that came out, someone was like, using an inhaler in public is shameful. I guess it goes back to that perception of weakness. So this must be an adult thinking that is a sign of, is shameful. I didn't finish the 10 seconds.
But
What do
I
you
think
tell
you're also doing it wrongly.
I'm doing it wrong.
You're doing it wrongly because you're not now supposed to like, you see what I'm doing? I'm not breathing.
Oh.
That's what you're doing.
I'm not breathing.
You're not breathing.
Hmm.
And it's not supposed to be that complex either.
Okay.
So the moment you're pressing your inhaler,
Yes.
you breathe in the same time. When you're told to hold, it's not like pause. No. Just for like 5 seconds. Those are enough.
It is
And
not
then-
dramatic as you're
Yes.
putting it.
Now,
You're
I was doing a
dramatizing.
demonstration and now I'm being, you see, this is the shame I'm talking about. So, okay, so it's not shameful.
No, it's not.
It's
All
just
right.
another way of administering medication. Just
Yes.
like we have the oral, this is mist.
Yes.
It's another of administering that medication.
Now, when you're talking about reversing it, there seems to be an implication of either change of environment or change of activities. So now the opinion that came out was you can't do sports with asthma. Now, if I love sports, but yeah, like especially now you go to the field, it might not even be the exercise itself, but the dust in the field or the grass or someone punching you in the face. It's how do you can you do sports with asthma, or do you change your sports altogether?
You see, exercise itself or sports itself can trigger an attack.
Yeah.
But again, there are footballers who have asthma, not only footballers, athletes who have asthma, and they're doing their games normally. So I would like for sports, before a child with asthma participates, they can take a reliever, a bronchodilator, 30 minutes before they actually go in.
Okay.
And then they won't have any issues.
And are they doing it? They love
Yeah,
Georgina
first,
over there
right.
checking how
You see, it's not, people are not the same.
Yeah.
So there are people who have attacks in relationship to dust. Others, it's the pouring. Others, it's the emotions. However, if I am asthmatic and I don't get attacks when I run, then I continue to run because it's not harmful. However, today when you take your corticosteroids, you do everything. You can even have perfumes. Yes. Yeah.
So who regulates that?
Let me tell you what happens.
Yeah.
And I've told you before that asthma is your immune responding to something that is inherently harmless.
Or just
But there are some that are harmful, like infections. So when you're given corticosteroids, they are giving you, they are reducing the capacity to react. It means, think of asthma as a battalion of soldiers.
battalion
And
of
that
soldiers.
they will only awaken when they see things. So they just see some random demonstrators and they're out with guns.
Yeah.
They want to kill everyone. Okay? But there is some form of food we give them and they just sleepy all day long. Okay? The counter or the converse to that is that now demonstrators and goons can even come in our house and do other things. The common cold, the flu, the viral attack. You see, respiratory, they can come. However, our soldiers are sleepy. It means you can go run, you can be on that public transport that people are wearing perfumes. You can still do your things.
Yeah.
The only thing that you are now having an issue with are infections because your immunity is not able to react as agile as it was.
Yeah.
However, with corticosteroids, life continues. And that's why it is the mainstay of management.
Okay.
To also answer your question, asthmatics are encouraged to participate in sports.
Yeah.
Certain sports like swimming, because they say it strengthens the respiratory muscles.
Does it have to be a heated pool? Because now that is the other thing, the temperature.
No, but again, it shouldn't be very cold.
Okay. So no swimming in Europe. You know those people who do ice baths.
You see, they're asthmatics in all weathers. So for me, it's just how you manage it. And it's a case by case. People are not the same.
People are not the same.
Yeah.
Okay. So now the ones who say herbs can cure asthma. Can herbs cure asthma or herbal interventions, herbal treatments? You're laughing.
What kind of herbs are you
I don't
talking
know.
about?
Someone is talking about maybe herbal things that they drink or I don't know. So these are opinions.
No. Let me take that. You see, how do you define cure? What is cure?
Reversed.
No, cure is when you had it,
Now
you can never have it anymore.
Yes, that is cure.
Yes, now I'm cured.
Unless you acquire it again.
Yes.
Okay? However, asthma, it doesn't go anywhere. It's just controlled. However, there are those who outgrow it, meaning it does not exist anymore, even with exposure to all these things.
Aren't those cured?
You see,
They are
cure
controlled.
is a product of you manage it, okay, you treat it, and then it is cured.
Yes.
Okay? So, and that is the definition from a pharmacological aspect.
Yes.
Is I give you an agent or a treatment,
Yes.
and then you are free of the pathogen or the condition following the intervention. But these people who outgrow it, they don't outgrow it because of the medications we give them. It's just their immunity evolves.
Yeah.
And that's the aspect you're talking about. So it is not like if it was something we could do, then we could do it to every child.
Yeah.
But there are people who just have asthma the rest of their life.
So
but they can also have it well controlled.
Yeah.
In a manner that you never know if they're asthmatic.
Okay. So then, to summarize, then in the context of asthma within Africa, so many of us have encountered it either with a colleague, a family member, and all that. What would you say? Because this is not just something that's distant.
Mm-hmm.
Anyone could get it at any point in their life. So I guess I'm asking for final thoughts on this, starting from that side.
I would say for asthma, I would still emphasize on the oral corticosteroids that people should not use them to control symptoms as often. Because there are different forms of asthma. There is the mild form where you get exacerbations, like the attacks. There are maybe once or twice a week. Then there's the moderate where you get more than that. Then there's the severe form where by maybe every other day you're having symptoms. So if you're in that category, it's better you get an inhaler.
Yeah.
And not, people usually use prednisolone. So get the inhaler or the combined form of the inhaler to control your symptoms.
Okay.
Because the long-term effects is also not good.
Yeah. All right. Dr. Georgina.
I think on my final take, I'd say for people who are already asthmatic and they feel like they're not in safe spaces, like you feel like you cannot use your inhaler out in public, or you'd rather suffer an attack than let somebody see you use your inhaler. It's good for people to get educated and sensitized on asthma. Asthma is not weakness.
Yeah.
Yes, it is a chronic disease by itself. You cannot grow it if you had it from childhood. And again, you can still live comfortably in life, do your other activities in life with asthma. So it should not be something that should be limiting how you should live. You just choose to avoid triggers.
Okay.
Yeah.
Avoid the triggers. Finally. Yeah, okay. Bless us with your wisdom, doctor.
So for me, my take on asthma, just like any other chronic condition, you have to have self-awareness, seek knowledge, so that you don't walk into every term, that one and the other one, and they give you herbs, others give you that and that. So you don't have to be mismanaged. I'm not saying you be a doctor, just have some information that my child has an allergic reaction to dust, to cold, to all these kind of things, so that you understand. So not every single day you're pumping them with medication. And we know that the medication is going to have, it is a temporary reliever. However, as opposed to earlier times, we are doing very good in terms of asthma management. So there's a way to control it and still have a normal life. It does not reduce your lifespan. The only thing you need to is to control the attacks, reduce hospitalization, and reduce the general cost after complication and how you manage the cost. So generally, it's just seek knowledge, understand what you're dealing with, what to do, what not to do, and it's out there for you to learn.
Okay.
Yes.
All right. Thank you very much. And of course, here on the Med Squad, we say, if you sense a whiz, kid, get help. Don't just whiz through life. There's actually help. It is reversible. And if there's any information you found on this episode that was helpful to you, or that taught you something new, or you just want someone to hear it, share the episode. Don't keep the information to yourself. And follow us, of course, on our platforms at the Med Squad Pod. Stay safe and avoid the triggers. You've had all the information here. We'll see you next time.